Hello everyone. How can I increase my testosterone level? This channel is already about that, friends. We see varicocele disease more, especially in friends who deal with weight sports. What is varicocele disease? It is the deterioration of the function of the veins of the testicles, the deterioration of the blood supply of the testicle, and some things going bad in the testicle. Does varicocele disease cause low testosterone? Or does varicocele operation increase testosterone? Last week a meta-analysis was evaluated. Meta-analysis brings together studies on a certain subject and draws a meaningful conclusion. Here is the result of this publication. They evaluated 48 publications. Whether the patient's testosterone is below the lower limit of 300 or above. Does testosterone increase when we perform varicocele operation? Regardless of pituitary hormones or sperm production. It was revealed that the testosterone level increased rapidly after the operation in patients who had varicocele disease. I think this meta-analysis publication is a very important publication. So if you have varicocele and your testosterone is low, the most logical thing is to have varicocelectomy, friends. Because it was revealed that the level of testosterone increased very significantly after these surgeries. After your varicocele surgery, the blood supply and oxygenation of your testicles increase. That dirty blood starts to circulate quickly. The temperature of the testicles drops, friends. And when the temperature drops, the testosterone and sperm-producing cells here start to work better. And how the operation is done is obviously very important. Many friends ask if it is necessary to remove the vein. It is not very necessary, friends. In cases used in these studies, the vein was not removed in patients who underwent varicocelectomy. But you can remove the vein if you want, that is a separate issue. But it was done without removing the vein in this study. In 48 publications, all of them were performed without removing the vein. At the same time, microdoppler microscope was used specifically for the patients. Microscope is important in varicocele surgery. Friends, we also use Doppler. Friends, Doppler is very important. It is necessary to say that. When you use Doppler, you can see the artery clearly. And since you detect the artery, the success rate of the surgery increases much more. This is how I perform varicocele operations. So as a result, if you have varicocele and your testosterone is low, if you have complaints about it, there is no harm in having varicocelectomy. And your testosterone level will increase. Your complaints such as loss of sex drive and erectile dysfunction may improve, friends. But there is no full guarantee. The doctor evaluates this and decides accordingly. There may be other reasons for these. So if your testosterone level is low, varicocelectomy will raise it. Thank you for listening, best regards.